So one of the studies that I would just highlight but not discuss further is about screening. So right now the screening that is recommended is with a low-dose CT scan in a high-risk group, and this is based on the National Lung Screening Trial, just based on age and smoking history, and those are patients that will screen with a low-dose CT scan. So now we're just learning more about that and how to become more efficient with that process, because hundreds of thousands of people are being screened every day, so it's a huge burden on the pulmonologists and radiologists to find all those small nodules, that can be just in a few millimeter range. So now we're using more and more artificial intelligence, machine learning techniques, and one of the studies that I'll highlight is an end-to-end algorithm, like an algorithm that use deep learning techniques for detection, but also for diagnosis. So just by providing the images, that algorithm was able to categorize nodules that were malignant with a very high accuracy. So I think the process is still the same. What's recommended is a low-dose CT scan in a high-risk group, but we are learning how to perfection how this process, how to be more efficient and create less burden for the clinician and for the radiologist. So I think that we're going to hear more and more about how we can use, how we can apply artificial intelligence into lung cancer screening. COPD, I think I think the answer is more complex, because we just need to add the clinical information, the spirometric information, and imaging. And I think the imaging probably in the future will be able to help. Right now, screening for COPD is not recommended, but for example, in lung cancer screening, emphysema is one of the most common incidental findings, and I think we're learning what to do with that information. This is one of the things that actually I'm studying myself. What is the clinical significance of the emphysema that we find in screening, but in lung cancer screening. But it's not something that's recommended now, and I'm not aware of any other newer tools for screening of COPD. One is a common medication that is prescribed. The idea is that steroids they reduce inflammation in a non-specific way, and we know that inflammation itself is part of the pathogenesis of lung cancer. So that study kind of reinforces supports that idea that maybe reducing inflammation may reduce the risk of lung cancer, and because they are the risk factor is the same for COPD and lung cancer, and so maybe we'll find a way to prevent lung cancer just by using the same medications that we use for COPD. Now that study, I don't think that conclusion from that study is not ready for prime time. I don't think we're ready to drink that Kool-Aid yet, but I think it's an interesting idea. I think that idea is asking for a large prospective trial for us to test that.